When I joined IntraHealth International as the new president and CEO back in early 2020, I was so excited. I thought I'd be joining you all in person at our SwitchPoint 2020 event. I wanted to be there with you in Saxapahaw, North Carolina. I wanted to see the inspiring stage talks in person, chat with you all between sessions, exchange our big ideas, think through how we could partner on them, and then go kayaking together right outside on the Haw River. I never predicted that we'd have to postpone our in-person event that April. And I certainly never predicted that over a year later, we'd all still be doing so much of our work remotely. I thought that here in the United States of America, we could manage this. I underestimated the pandemic. I underestimated how quickly and easily a lapse in accurate messaging and leadership could fan the flames of a pandemic. Now we've got these amazing vaccines, and the rollout, at least in the US, is in full swing. But from the very beginning of the vaccine rollout, we've been seeing inequities. Just a few months ago, on January 18th, 2021, WHO Director General Tedros said, "The promise of equitable access is at serious risk." More than 39 million doses of the vaccine have now been administered in at least 49 higher income countries. Then in January, he said just 25 doses had been given in one lowest income country. Not 25 million, not 25,000, just 25. Luckily, we've made some progress since January, of course, but it is too slow. Equitable access is at risk. Lives are at risk. Vaccine equity means getting the vaccine to all people, not just rich people. In the US, we have to overcome the racial, ethnic, and class disparities we're seeing, so we can play a role in mitigating the disproportionate impact of the virus for people of color. Globally, it's simple. We need access for all people now. Now. And we need to invest in a diverse health workforce to get that done. I've noticed that throughout this vaccine rollout, we've been really focused on the product and not enough on the people. Not enough people are talking about the fact that we'll need health workers to make this happen. The nurses, the midwives, the community health workers, the pharmacists, they need to be put at the front of the line for the COVID-19 vaccine in every country. And how are we going to prepare them for this massive global vaccine rollout that's bigger and faster than humanity has ever attempted? There are 7.8 billion of us today. Is our health workforce prepared? Are our health systems prepared? I think we agree, no, not yet, but they can be. IntraHealth and our partners are working toward building health systems that can cope with this COVID pandemic and future shocks. We're preparing health workforces around the world so that they'll be safe, equipped, informed, and all around prepared for this undertaking now and in the future. We're working with governments and partner countries to collect and use data that can help them pinpoint the potential outbreaks and how do we organize our workforce to be in the right place at the right time. We're rolling out new training for health workers and helping them provide routine services in new ways that are adapting to the COVID pandemic. We're getting personal protective equipment to health workers who need it. We're partnering with religious leaders and youth advocates to spread accurate information. Let's be clear, we still don't know what's ahead. We're still in danger from this pandemic and future pandemics. And I'm convinced now that our mission and vision, which is that everyone everywhere should have access to the health care they need to thrive, is more crucial than ever. So one thing that you can do today, right now, is to make sure your elected representatives in government know where you stand. Call on them to act for health workers. Thankfully, by now, almost all health workers in the U.S. have been vaccinated. Unfortunately, the situation in many countries is different. So let's ask our governments to prioritize all frontline health workers in the COVID-19 vaccine distribution and support the WHO COVAX Alliance to ensure that all people everywhere, including frontline health workers, get access to a COVID-19 vaccine fast. Health workers save lives. When we invest in them, we invest in our future. And that's the future we all want.